Thank you for answering the multiple choice questions. Welcome to the Postnatal Growth and Development Lecture. I am Dr. Vicente M. Caluwag III, your lecturer for this afternoon. These are the following objectives of this lecture. Apply the principles of anthropometric measurements in assessing postnatal growth of children. Apply the facts of developmental domains in assessing probable developmental problems in children. Now, what are the contents of these objectives? 1. Anthropometric measurements at different age groups, which include weight, length or height, head circumference, chest circumference, dentition, and facial growth. The nutritional status of a child based on Waterloo's classification and the basal metabolic index. Developmental milestones and the domains of behavior and development. Now we go to definition. What is growth? Growth refers to an increase in physical size of the whole or any of its parts, while development is a process of unfolding, expanding, becoming fuller, more complex, and more complete. Likewise, it encompasses growth, increase in understanding, acquisition of new skills, more sophisticated responses, and behavior. Now we go to the anthropometric measurements. Weight. We now compute for the ideal weight based on the Waterloo's classification. To compute for the desired body weight for infants less than 1 year old, here is the formula. For infants less than 6 months, the formula is 18 months times 600 plus birth weight. While for infants more than 6 months, it is 18 months times 500 plus birth weight. For children more than 2 years and above, it is weight in kilograms will be equal to 18 years times 2 plus 8. Whereas for children 6 years and above, we use weight in pounds equal to 18 years times 7 plus 5. Likewise, we need to use the necessary growth charts and check the percentiles if the patient falls in the correct appropriate weight. Likewise, I'll be giving you some mnemonics for you to easily remember these ideal birth weights. And lastly, we should weigh the patient accurately using proper weighing scale. Now here are some mnemonics which will help you memorize easier or remember different birth weights at different age groups. For example, AH was born full term with a birth weight of 2,670 grams. She is now 4 months old. What is her estimated weight? So, as said earlier, the computation for the weight is 18 months times 600 plus birth weight, since the patient is only 4 months old. So you multiply the age of months, which is 4 times 600 plus 2,670, it will be 5,070 grams or 5.07 kilograms. Another example. Momoy is a 9-month-old Filipino boy. What is his expected weight? So Moy is a 9-month-old Filipino boy. So we will compute for his ideal body weight. So 18 months times 500 plus birth weight. 500 because Moy is more than 6 months old. So 9 times 500 plus 3,000 will be equal to 7,500 grams or 7.5 kilograms. Now we go to the computation for wasting. So for wasting, we use the formula actual weight over the ideal weight for actual length and or height times 100. So under this, we have the classification to determine whether the child is normal, mildly wasted, moderately wasted, and severely wasted. We now go to the measurement of length. Let us put into our minds that the average Filipino length at birth is 50 centimeters. Now we go to the different increase in length per quarter. For the first 3 months, there is an increase of 9 centimeters. For the succeeding 4th to the 6th month, an increase of 8 centimeters is noted. From the 7th to the 9th month of age, a total of 5 centimeters is added to the previous length, whereas from the 10th to the 12th month, a total of 3 centimeters is increased during these last 3 months. So one example is, for an average Filipino 1-year-old, 12-month-old infant, the total length is 75 centimeters. On the basis of the birth length of 50 centimeters, then you add up the 25 centimeters growth in length for the first year. Now we go to some of the mnemonics. As you can see in this slide, a 1-year-old child is approximately half the birth length, or approximately 30 inches, whereas a 3-year-old child is approximately 3 feet tall. And a 13-year-old teenager has 3 times that of his birth length, which is approximately 150 centimeters. Now let's go to an example. Remember Momoy, that 9-month-old Filipino boy. We already computed for his expected weight. Now what is his expected length? So for his expected weight of 8.1 kilograms, his length is supposed to be 72 centimeters on the basis of the increase in the following length. Remember that the birth length is 50 centimeters. We add 9 centimeters for the first 3 months, 8 centimeters for the succeeding 3 months, and 5 centimeters from the 7th to the 9th month. So we add 50 plus 9 centimeters plus 8 plus 5, and we total to 72 centimeters. Now for the classification stunting, it is the actual height or length over the ideal length or height for age times 100. And it also has its own classification, whether it is normal, mild, moderate, severe. Just take note that the normal value for stunting is more than 95%, whereas for wasting it is more than 90%. Likewise, it is ideal to use the WHO growth charts. If unable you are to use the WHO growth charts, it is more easier and it is more acceptable. Now we go to the measurement of the head circumference. The average birth head circumference is 33 to 35 centimeters or 34 centimeters. Now, during the growth of the head circumference, take note that we use inches here instead of the metric system. So we have to convert the inches to the metric system for proper analysis. So for the first 4 months, there is a growth of 2 inches. That is half an inch per month. For the last 8 months of the year, another 2-inch growth is noted. That is approximately 1/4 inch per month. So for the first year, a total of 4 inches in growth is noted. Whereas in the second year, for the whole year, a total of 1 inch. From the 3rd to the 5th year, it's 1.5 inches or 1/2 per year. And from the 6th to the 20th year, it is 1/2 for every 5 years. Likewise, we should take note of how to correctly measure the head circumference of a child. It should measure from the widest angle, that is from the glabella to your posterior occiput area. We should also take note that the presence of fontanelles. There are 2 fontanelles present at birth. One is the anterior and one is the posterior. The anterior fontanelle closes last, which is approximately 12 to 18 months, while the posterior fontanelle closes during the first 2 months of age. Next on the growth chart will be the measurement of the chest. Now, how to measure the chest? Patient is placed in a recumbent position, and usually measurement is done at the level of the nipple. So measurement is always also done midway during inspiration and expiration. These are the normal measurements. At birth, the transverse antero-posterior ratio is approximately 1, and as the child grows older, the transverse AP ratio is larger. Now this diagram shows you the proper way of measuring the head circumference, the chest circumference, the length, and even the abdominal circumference. Another way of assessing the nutritional status of an infant or a child is through your body mass index. This is a statistical measurement which compares a person's weight and height. It does not measure the percentage of body fat, and it is used to estimate a healthy body weight. It is the most widely used diagnostic tool to identify weight problems. So you would see here the computation for the ideal body mass index. So BMI will be equal to the weight in kilograms over the height in meters square. Likewise, there are normal values which we should follow in order to assess whether the child is adequately under or overly nourished. So a normal BMI will be from the range of 18.5 to 25. Underweight is lower than 18.5, overweight is above 25, and obese is that children with an BMI index of 30. We now go to the dentition growth. Now this is one of the more commonly asked questions by parents as to when their child's first tooth would appear. But before that, let us discuss briefly on the sinuses. Take note that the frontal sinus is radiologically seen by 3 years old, while the maxillary sinus is at 1 year old. For the teeth, it is said that the first deciduous tooth to appear is by 6 months. And take note that the first deciduous tooth to appear is the central incisors. And take note for the pattern of development of each individual tooth. For permanent teeth, the permanent teeth usually erupts by age 6 years old. And the first permanent teeth to appear is your mandible, molar mandibular tooth.